terms of the package itself, could you tell us a little bit about what's actually in it?
Maybe we'll start with the tools, because the tools are what can be used on a day-to-day basis. So we have 7 supervision tools. So these are really meant for guiding the work of a supervisor's relationship with a caseworker. And it's really one of the key messages of the entire training is that supervision is really about a relationship and this kind of coaching idea between a supervisor and case. One of them that I'm really excited about is a tool around individual supervision. It's called the Individual Supervision Record. And so what we have within the tool is we provide guidance, like what is individual supervision, why is it important, and it goes through these 3 main functions. What is the suggested frequency that individual supervision takes place, and some guidance as to like how to have a conversation with a caseworker. So what's provided in the actual tool itself, administrative. Let's talk about your caseload. Let's talk about maybe some challenges that you're having with different referrals. And how can we address those together? Then we talk about the development and the skill building of the caseworker. What are some of the areas that the caseworker is still struggling with, and some areas that we might be trying to develop their knowledge and skills on, and making sure that the supervisor is spending time to build the skills from caseworkers. And then finally, the last one is the supportive function, and helping the caseworker have the space to reflect on their own feelings and the reactions that they're having from these really complex cases, making sure that they have that space to process. So their own well-being is really important. We're not saying as the case management task force that these are required, that now everyone who's doing case management needs to use all 7 of them immediately. It would be a lot. These are available to help strengthen your supervision practice within case management. What we're really encouraging is that organizations who are implementing case management can take a look at these tools and they can decide, we can start using these within our case management work, and they can really adapt them as they see appropriate. But these are just ways to help facilitate and add structure to the work of supervision within case management. Now onto the modules. We have 6 modules in this case management supervision and coaching training. And within the modules, we have the introduction module to kind of like set the stage, as we do with every training. And then we also have the closing module to help wrap things up. So those are our kind of bookend standard modules. And then the core content are 4 modules that really focus on supervision itself within child protection case management. The first module is really defining supervision. And so that really helps explain to our colleagues who are doing this work, what is this thing we call supervision? Why is it important within case management? And we also talk about the evidence base that we have for supervision, which is really important. These 4 functions that I've spoken about, and also the idea that within supervision is this role of coaching, and really the relationship that's required to build with a caseworker. The second module is supervision practices and tools. And so those 7 tools that I mentioned to you, this is a module where we really unpack those, and we talk about ways to use those tools effectively and safely as a supervisor, and how to really use them to really support a caseworker. You know, there's a lot of thought that went into the way that this relationship is supported within the tools themselves. A lot of role plays actually in that second module, practicing using the tools, which really bring them to life, rather than just like handing someone a tool. This really helps them practice, like if they were doing an observation, how would they use that tool, and then how would they give feedback to a caseworker. After the practices and tools module, then we have supervision skills. We talk broadly about competencies that are required of supervisors. And then we really delve into some of these core skills. And one of the most essential ones, not a surprise, is around communication. So how can you communicate with caseworkers in order to help build that relationship where you're asking them open-ended questions, you know, you're really helping them to reflect and really supporting this processing of what's happening for them. Those communication skills are really foundational in order to successfully supervise caseworkers. You have to also recognize that sometimes caseworkers might make mistakes, they might need some redirection, and how do you do that in a supportive way? Feedback is something that a lot of us find challenging as supervisors. We also talk about the guiding principles and how to apply them within case management. So that skills module really requires a lot of time and a lot of reflection in order to promote the skills of quality supervision. And then finally, we have the staff care and well-being module, and that is really something that when we were taking this package and doing some of the pilots with the field, we heard very loud and clear from our colleagues is that this idea of staff care and well-being is something that really needs to be included, because the work of child protection case management in humanitarian settings is extremely stressful. Caseworkers are being exposed to some of the worst things that we see happen to children in the world, and they feel a great responsibility to support these kids. And supervisors also are feeling, a similar burden to support caseworkers in doing that work. So we spend time together in that module reflecting on the stress that supervisors themselves are feeling and how to really support caseworkers and help them to really process what they're experiencing in their work and how they can be a healthy case management team. And one of the key messages there is that we really encourage supervisors to model healthy boundaries and self-care within their own interactions and their own workplace, because the modeling really helps promote that for caseworkers themselves.
Now the package is here. Has it been rolled out? What's happened since you've developed the package?
Yeah, so the rollout process has been ongoing for quite some time now. And it's been quite an iterative process. And we've really tried to make it a real interagency initiative. We had over 15 or 16 countries apply, and we selected 8 of them. And so it was those 8 countries who were selected to join in this training of trainers. And the country teams were divided. So we had 3 teams come to the first training, and they were Nigeria, South Sudan, and Myanmar. The second training was Turkey, Iraq, and the whole of Syria. So coming from all the cross-border programs, as well as from within Syria. And then the final training was for Burundi and Niger. So the training participants, before they came to those trainings, were required to complete some pre-course work prior to coming to the training. And the idea behind this was that it's been seen in previous trainings that people have different levels of knowledge, and we really wanted to ensure that everyone was at least very familiar with the case management guidelines. That happened, and then in the training itself, we had quite an intensive process to help our training participants really be prepared to deliver the training and bring the content back to their countries. We first had the first day of really looking at adult learning and how to facilitate trainings to adult learners. So that included, understanding ways that adults learn and how to facilitate and give feedback in a training. The other 4 days were really focused on the other 4 modules of the training. So that included them really being participants themselves and really delving into the training content. And then each day, the participants also were given time to come together as a country team. So, for example, like the Turkey country team came together every single day and they talked together, how are we going to bring this back to our country? And how are we going to select participants? How are we going to engage the working group? Really making all of these considerations. And on the last day, we reviewed the country rollout action plans together to really help them feel confident that they could really bring this work forward and who was going to be responsible for what. We also had country support focal points from the Case Management Task Force who volunteered to support different countries. And they met with them on the last day, either in person or virtually, and have really been providing this ongoing support.
What I really appreciate about the process and sort of the rollout and sort of the model that you described is just, again, how collaborative it is, how interagency it is, how each country team was comprised of various actors. And I think from local NGOs, international government, even maybe UN, really bringing people together to implement this in their own countries, right?
Exactly.
Which is fantastic and which shows a lot of buy-in among all of these actors, state actors, international actors, UN agencies, to really the importance of the work, but also the importance of actually implementing it and doing it in country.
Sure. We really tried to promote that those folks who would be nominated to join the training would be from the country, because we really want to make sure that this is not a one-off kind of thing with someone who's coming and going, but someone who's really going to be around for a while and really to continuously promote this, because we know that really structuring case management system and program takes a long time, and really investing in supervision will also take a lot of advocacy and take time. So having kind of our our champions at the country level who will be there for a while promoting this work. I'm really excited.